Why it's crucial to prevent musculoskeletal pain from becoming chronic. Number one, chronic pain alerts the nervous system. Persistent pain causes neuroplastic changes in the brain and the spinal cord. That is, the long-term pain invites the nervous system to join with them. The psychological impacts are chronic pain is strongly linked with depression, anxiety, sleep disturbances, and fear of movement. And these emotional states amplify pain and delay the recovery. And number four, it reduced, that is the chronic pain reduced the quality of life. And people with chronic musculoskeletal pain, that is the pain on muscle tissue, joint, ligament, tendon, these types of areas, and often suffer from the low energy and social withdrawal, relationship issues, and work limitations or unemployment. That is, it has long-term consequences. If the pain becomes chronic, the patient will suffer, or the person will suffer in low energy. He will lose his or her interest in his or her particular work, and he become in social withdrawal. He will become less interested to mix with his friends and families, and it has a big issue on relationship issues. That is, their conjugal relationships or familial relationships or the social relationships becomes in challenge due to this chronic pain. That is the chronic musculoskeletal pain, and the work limitation or unemployment. As a result, due to these consequences, the patient may become very depressed, and his work limitation may become appear, and as a result, the unemployment may appear, or he or she become an unemployed person. And number five, that is the increased healthcare cost. This type of chronic pain, that is, this chronic pain leads to repeated doctor visits, medications, imaging, and sometimes unnecessary surgeries. I'm saying this is unnecessary because if you are become serious in your initial stage, it is very easy to solve your pain within month or within 15 days or within weeks. But if it becomes chronic, you may be diverted to the surgery, and it places a huge burden. Accumulatedly, this is a huge burden on healthcare system and his or her families. And number six, risks of long-term medication use. Chronic pain is often managed with NSAID, that is non-steroidal anti-inflammatory drugs, opioids, and antidepressants. And long-term uses, this can lead to tolerance and dependence. That is, he or she become dependent on this type of medications, and it will create the gastrointestinal, renal, and hepatic or heart-related complications. And overall, he or she will become addicted on this type of drugs. And number 7, it's harder to treat later. The suggestion is acute musculoskeletal pain within days or weeks is often reversible with the right approach. That is, you have to choose the right approach. That is your responsibility to choose the right approach. If you select the wrong approach in the initial phase, then you may become a sufferer. And once it become chronic, that is the lasting more than 3 days, recovery takes longer and becomes more complex. So our expectation not to make the pain chronic, that is the not to suffer from long-term chronic pain. On message, we want to give you that is the physiotherapy treatment is very effective in this concern, and proper rest and therapeutic exercises, these are very effective. For this concern, you have to select the proper person, that is the proper physiotherapist, and proper places to get your right services. One important message we would like to give you that we heal pain through hands-on approach. That is a heal chronic or short-term or long-term pain through hands-on approach. If you like it or if you prefer, you can communicate with us, and hopefully, and we hope you will get a very good result from us. And our effort is for your benefit and your family benefit also. If you like it, please share it to your friends. That's all for today. See you next with an important issue with a short discussion. Thank you so much. Bye.